Students, today we are going to see one more topic from the subject called PT Orthopedics. Last week we have seen a topic on PT Orthopedics from the topic called the prerequisites and what is expected from the students at the time of PT Ortho examination. As a continuation to this topic, I told you I'm going to stress some of the other aspects in the future. So today's lecture is going to be on those aspects. If you remember last week, I told you that in order to prepare yourself well for the PT orthopedic practical examination, you need to develop your PT clinical, physiotherapy oriented clinical conditions. The clinical knowledge should be improvised, and then you need to develop the skill levels, various skill levels of physiotherapy practice from the exercise therapy and electrotherapy aspects. What are the skills I mentioned already? To make use of the leave time to practice on your models you can choose from your friends or family members at home, and you can try practicing them. Apart from these two, we also need to concentrate some other aspects when it comes to PT ortho practicals. You all know the PT ortho practical will involve a question. It can be a scenario can be given to you, or a clinical condition will be given to you. Based on that, you need to identify what are the physiotherapy problem list, and then physiotherapy aim for each to solve each problem in the list, and you need to set the goal and then identify the appropriate physiotherapy treatment modalities, which is called means. Identify that along with the specific dosage and duration and all the parameters, method of application, everything. And then you need to identify the appropriate outcome measure to check how efficiently your treatment is working, whether it need to be changed or not. Then you need to plan what are the home exercise programs should be given to the patient, and what are the do's and don'ts should be instructed to the patient. And finally, you need to fix the next appointment according to the clinical condition, whether it is acute or subacute or chronic condition. Okay. Coming to all these steps, I am going to stress the two important areas apart from the areas which we have seen already. The two out of two, the first one is goal setting. About goal setting, I already had a theory discussion with you in the class, in the college. And for those who did not attend those sessions, I would like to give a superficial explanation about how to set the goal. When it comes to goal setting, not only in physiotherapy profession, any profession, they need to maintain a principle called a SMART principle. S-M-A-R-T, SMART principle. S stands for specific, M stands for measurable, A stands for achievable, R stands for realistic, and T stands for time oriented. That means when you set the goal, it must have all these parameters clearly mentioned. The goal must be specific to the problem that you have identified, and it must be measurable one. You need to have a scale or something to measure it. When you give the treatment, whether the problem is improving or not improving, you need to be able to measure it. And when you set the goal, it should be achievable one. And then it should be realistic. From the past clinical experiences, evidences, it should be realistic. And the final one, which is very important, it should be time oriented. Within what time period you are planning to achieve the problem. So all these things must be done. Usually the long-term goal will be set, and in order to achieve the long-term goal, you will be split it into various parts, and those parts will be called as short-term goals. Okay. So once that is done, you are going to identify the most appropriate PT modalities, and in order to see when you apply the PT modalities on the patient to solve the various problems, after the treatment session, you need to check how well your treatment program is working. You need to have outcome measure. When it comes to outcome measure, there are two ways you can look at the outcome measure. The two types are there: primary outcome measure and secondary outcome measure. Outcome measure is the one which is going to measure the outcome of the treatment. That's it. That's why it is called as outcome measure. Okay, for example, when a patient comes to you with a problem of a shoulder pain and stiffness, the two important problems the patient complains to you: pain and stiffness, unable to move the shoulder. Okay. For this patient, you are giving, for example, you are giving only one treatment, which is IFT. IFT treatment you are giving to relieve the pain. By using the pain gate mechanism, you want to relieve the pain, so you are giving IFT. Okay. The next day the patient comes to you, you want to check the efficiency of the treatment what you are given the previous day. Now if you check the pain level of the patient by using the pain scale, it is called as, the pain scale is acting here. The pain is acting here as a primary outcome measure, because you aimed to reduce the pain and you gave the pain relieving modality and you are checking the pain. So everything in the same line. So it is a primary outcome measure. Suppose you are not using pain scale, you are using range of motion. By using goniometer you are using. Of course you can still justify your selection of outcome measure here, range of motion, why you are using. You can justify like, because I gave IFT, the pain is reduced. Because of that, the patient's range of motion might have improved. So I'm measuring range of motion. You can still justify. Okay, in this case, your range of motion outcome measure is not a primary outcome measure, it is a secondary outcome measure. In this case, in this example, because you gave a pain relieving modality IFT, called IFT, in the previous day, but today you are checking the range of motion. You are not checking on the pain, you are checking on the range of motion. Of course, your pain modality would have reduced the pain. Because of that, a secondary improvement called range of motion would have happened. In the shoulder, range of motion might have improved. And you want to check it today. And you are using a goniometer. So the goniometer, the range of motion measurement is going to be the secondary outcome measure. Like that, any of your outcome measure can be called as primary outcome measure or secondary outcome measure, depending upon how you are using it. So coming to outcome measures which are commonly used in physiotherapy practice are the pain. We use various pain scales for that, and then we use the outcome measure range of motion. We use goniometer for that. The goniometer is still used. Range of motion is still used to measure some fixed deformity also. Not only range of motion, deformity also is measured with range of goniometer. And then muscle strength to measure the muscle activity, muscle strength level. And then function. Function to measure various joints or part of the limb or the whole body. Okay, so various functional activities. So we have various functional scales available for it. Only to measure the shoulder, we have shoulder functional scale. To measure the knee joint related functions, knee functional scale. To measure the back, the spinal areas, we have spinal functional measurement scales. For the whole body, activities of daily living, functional scale. Like that, we have many. So for each outcome measure, we have different outcome measurement scales available. These outcome measurement scales are called as outcome measurement tools. To use the outcome measurement tool, we need to identify various procedure. The procedure is there. You might need to identify whatever has been described by the original author who researched and introduced the outcome measurement scale. That procedure must be followed. We cannot use our own procedure. Whatever has been already proved, evidence based outcome, whatever has been already published through research, that method only we have to follow. Those scales only we have to follow. This is what is called evidence-based practice. Time to time, the various researchers in physiotherapy practice, they develop various outcome measurement tools, and they describe, publish various different types of procedure, what appropriate procedures to be followed when they do the when they use the scale. Okay, so we have outcome measure and outcome measurement. For in order to measure the outcome, we have outcome measurement tool, and each outcome measurement tool has got a specific procedure. So this also we need to go through and make ourselves acquainted for all these outcome measure tools. We have seen pain, range of motion, muscle strength and function. These are very commonly used outcome measures in our physiotherapy practice. Apart from this, we can also use outcome measures which are a bit rare, but still we can use, provided we use the intervention, the physiotherapy modalities specific to these outcome measures. For example, limb length. Suppose your treatment is going to affect the limb length can be your outcome measure. Limb girth. Suppose your your intervention going to change the bulk of the muscle or the edema in the limb girth can be your outcome measure. Joint figure of 8 measurement by using inch tape or the thread method. Suppose if you have a joint effusion and your intervention is going to reduce the effusion, this figure of 8 joint measurement can be your outcome measure. Tenderness also can be outcome measure. Suppose your treatment is going to change the amount of tenderness perceived by the patient, tenderness can be the outcome measure. We have scale for everything. Reflex can be outcome measure. Reflex also can be improved, can be changed during the course of treatment. Sensation, sensory level, deep sensation or superficial sensation or combined sensation, whatever it is, depending upon that. Mostly the sensation will be an important outcome measure in neurological patients. Sometimes if the sensation also is accompanied in the clinical scenario as a problem, one of the problem in the list, we can include sensation as a kind of outcome measure, maybe a secondary outcome measure. Then muscle tone. Muscle tone, when there is a neurological involvement, muscle tone can be a good outcome measure. Neural tension, that also one of the important outcome measure. When there is a combined musculoskeletal neurological problems, neural tension also can be used as outcome measure, where we have the neural tension test, and the neural tension test will be measured based on the angle of the limb through which the patient is able to perceive without pain or with a tolerable pain level. So the range of motion for the particular limb while performing the neural tension test can be the outcome measure here. First lump test, prone knee bend test, straight leg raise test, like that. They can be used. Gait can be the outcome measure. Gait parameters can be used as outcome measures. Cadence, stride length, limb length, step length, like that. Posture can be the outcome measure. If your intervention is going to improve the posture can be measured. We have plumb line measurement scale available for it. And then balance and coordination, balance test for the part of the body or the whole body. Coordination for the part of the body or whole body. We have outcome measurement tools available for this. Well-researched outcome measurement procedures available for all these outcome measures how to be measured. So these are the rare outcomes we use in the physiotherapy practice. I want you to get acquainted yourself with these outcome measurement tools. So listen to this lecture video completely, and I'm going to give you a small task about it. So I mentioned some common outcome measures and rare outcome measures. I'm going to list it out and give it to you in the Google Classroom. So during this holiday time, you need to identify what are the important outcome measurement tools available for these outcome measures, and what is the procedure, how the outcome is measured by using this tool, the procedure of outcome measure. That also you need to study. Take small notes, very simply. In a short note, I want you to prepare and type them neatly and send it to me. Okay, for the outcome, there are 4 important common outcome measures, and then 12 rarely used outcome measures. Okay, the rarely used outcome measures most often used as a secondary outcome measures in our PT practice. So I want you to be more acquainted with outcome measures also. Okay, thank you very much. Have a nice day.